This week marks the second anniversary of Governor Little's COVID stay-home order. Remember that? At the time, we knew very little about the coronavirus and the implications of a global pandemic playing out in real time. To be frank, in early 2020, it was a scary and trying time for a lot of people in our community. And 2 years later, we're reflecting on the early days of COVID and the changes in community perception and the treatment of our medical community. Earlier today, I sat down with Dr. Jim Souza, Chief Physician Executive for St. Luke's Health System, St. Alphonsus Chief Clinical Officer, Dr. Stephen Nemerson, and Elke Shaw-Tulloch, who's an Administrator of Public Health for Idaho Health and Welfare. We start our conversation reflecting on the days leading into Governor Little's tone-setting stay-home order.
I remember the first meetings we had standing up our incident command, where we brought our experts together and we started preparing, and we were scared. Right? We didn't know exactly what we were dealing with. We didn't have anything in terms of treatment other than symptomatic supportive patients. And all the data showed that we were going to run out of beds and we were going to be taking care of people in the hallway. And so we rapidly prepared for that. We mobilized equipment. And then we just stood ready and took our first patient. And fortunately, as I said earlier at the beginning, we were able to accommodate the numbers of patients that were coming in because of the fact that people were sheltering in place.
The emotions that are just palpable as I think back on them were fear and uncertainty, but there was also this amazing energy, sort of a pragmatic optimism. Like if we keep our heads down and keep working together, we're gonna come through this. Oh my goodness, long days, scrapping for any information that might be helpful, any resource that might be helpful, because there was so much we didn't know, making up policies and changing them the next, maybe later the same week because some new little snippet of information came in.
How did you internally, juggle, okay, what is our messaging going to be? How do we keep people calm while also being factual with them?
We were all very thirsty for information, and I feel incredibly fortunate. I think Idaho is incredibly fortunate that we have a really, really strong team of scientists here in health and welfare, and they're sitting on national committees. Like for example, ACIP, we have Dr. Hahn that's sitting on some of these front row seats to what's happening regarding immunization. So they're bringing information back. They're challenging some of the assumptions that are being talked about at the national level. And so we're trying to bring that information back and distill it and package it in a way that makes sense to people. Some of my peers across the nation didn't have that same experience. It was very isolated. They had hospitals warring still, partners that weren't really aligned. And I feel like we tend to, in Idaho, do a really great job of, in these times of crisis, coming together and really sharing the experience and sharing it and advancing our efforts well.
For a time in 2020, the phrase, "we're all in this together," really meant something.
We had the community coming together to deliver food. We had healthcare workers who were working shifts that were really unfathomable because of the demands that were being placed on them. And the community bonded together to support those individuals, to cheer them when they were coming in. We had a drive-by parade in front of the hospital that was COVID safe. It was just wonderful to see, and it kept people going.
It was that community togetherness that put the gas in the tank on that. And we lost that.
Heading into the end of 2020, the promise of an effective vaccine brought hope. Ironically, the vaccine rollout marked a change in how the medical community was treated.
And then in late December, the vaccines hit. And I cannot describe the feeling of hope and joy. But it was shortly after that the us and them started, the purveyors of misinformation on vaccines started to spin their stories, and that created this divide, and that's how we went into the Delta surge, which was really unfortunate, was with that sort of divided populace.
And that's when our caregivers started experiencing this trauma, this moral trauma, to watch unnecessary deaths. And to, at the time of intubation, I remember hearing this story, having a patient say, "I don't have COVID, you're lying to me, leave me alone," while the team is trying to save a life. So compounding the fact that the public support began to wane was the fact that our caregivers were experiencing this incredible moral trauma.
I think in our core, we all feel very good about what we've done. And so we did kind of had to take that approach a bit of just head down, keep pushing through, don't let that affect us. I mean, we weren't frontline facing the patient, but certainly I think our staff have gone through, and at the local level as well, certainly have gone through a lot of that same sort of trauma. Like, why don't people believe us? How do we get people to really understand that we are here with good intentions, where we would never do anything to deliberately mislead anyone? And I think those were like the biggest things that we're grappling with, but really staying true to ourselves as well, that, we're here doing the right thing.
There's a lesson from within healthcare that I think might be good for all of us. A lot of our providers experienced it in the Delta surge with that hostility Dr. Nemerson talked about. When we still knew we had a mission, a guiding mission to save that patient's life, and we approached that patient with curiosity and, why do you feel that way? And tell me what you want. If we can do that more between us, amongst us, we're going to be successful. We got to have more of those conversations where we get curious and seek to understand one another. But it's united we stand for me.
We're blessed by incredible science and technology, and the fact that new therapies could be mobilized so quickly, that the vaccine could come through at a speed that was literally lightning. And we were able to use those tools so quickly to literally save so many lives. This pandemic isn't just about the lives that are lost. It's about the millions of lives that have been saved